Oh, man. I don't know if we will ever be able to have a child.
What is this? Don't think like that. We're gonna have a Dolina. She's gonna be running around with her sundae and, you know, ice cream in her hair, and we're gonna have a child. So don't think like that.
Look, there's a clinic. We can go check it out there. Maybe they can help us.
Don't last. Come here. Hi. This is your coat, and go that way.
Okay.
Can we come in?
Yes. Please come in. Hello, Dola family. Please take a seat.
Oh, thank you.
My name is Dr. Maria Aman, and I have like so many certificates right up there if you'd like to take a look. I'm very certified in medicine and science and fun stuff. So, what seems to be the problem?
Well, we seem to have trouble conceiving.
Can't make a baby. It's not working.
I see.
No.
Do you think you might know why?
I have no idea. That's why we're here.
Yep, we came to you for help.
As your doctor.
Sounds good. Those are some very interesting genes. Could you just stand up right now?
What's wrong with me?
Wow, they're quite stylish. Sounds good. Well, we'll go diagnose your problem.
Thank you.
Okay, thanks.
Let's go! Here's your urine cup.
Okay.
You know what to do.
I do know what to do.
Dola number 2, you're next.
Oh.
There you go. Here's the urine cup.
I'm gonna need something a little bigger.
A little bigger? Okay, here.
That's perfect. Thank you.
Your wife has a very big bladder.
Apparently.
Wow. For a small woman, you sure know how to pee. Thank you very much. So, after compiling all your data from your diagnosis tests, I've come to the conclusion that Shane is infertile.
Do it all along.
You have a disorder called teratospermia, which is irregularly shaped sperm, meaning that they have poor mobility and they can't reach Ellen's ova.
But why is that?
Well, it might have something to do with those tight jeans that you've been wearing. Have you always worn those?
My whole life. I like them. They make me feel good.
Well, do you want to have a child?
Yes, I do.
Then maybe try switching over to something more loose and flowing.
Like these?
Yes!
Okay, I can wear these. These are nice.
I would recommend a procedure called ICSI, which stands for intracytoplasmic sperm injection. So it's commonly used to treat males who have infertility problems, such as low sperm count, the sperm are unable to penetrate the ovia, or teratospermia, which you have. And this procedure is a specialized form of in vitro fertilization, and basically an ovum extracted from the female is collected and individual sperm cells are injected right into the ovum, and that embryo is later transferred into the female uterus. So I have a video right here illustrating the process.
A further development of IVF is the technique of intracytoplasmic sperm injection, or Icsi for short. This is a method which has revolutionized the treatment of male infertility in recent years and gives men with poor quality sperm the chance of fathering their own children. In natural conception, many millions of sperm cells in each ejaculation are necessary for fertilization. In Icsi, just one may be enough. Women having Icsi are given special reproductive hormones to encourage several eggs to develop in the ovaries. The eggs are then removed from the ovary in a short outpatient procedure. Fertilization in Icsi is achieved by injecting an individual sperm cell into each of the collected eggs. For this purpose, each egg is placed under a very powerful microscope, and a single sperm cell is injected directly into it by means of a very fine needle. Following injection, and after about 24 hours in the incubator, most of the eggs will show signs of fertilization, and the cells divide and multiply to form an embryo. After 2 or 3 days, a healthy embryo will comprise around 8 cells. It is then transferred to the uterus by means of a thin flexible needle, where it is left to implant and form a pregnancy.
So what are some advantages of this technology?
Well, basically you're able to conceive a genetic child, which you've always wanted to do. It's a relatively quick procedure. It has a high chance of fertilization. It's minimally invasive, and it's cost effective as well when compared to the other procedures. But there are some downfalls as well, because there's a chance of multiple births or ectopic pregnancy. There's also an increased risk of rare genetic problems such as chromosomal abnormalities, and there's also potential unknown risks to the embryo.
I'm willing to take the risk.
You're willing to take the risks? Okay.
Yeah.
There's some societal issues involved as well. Like, there's usually some religious objections from institutions such as the Roman Catholic Church, and also ethics kind of plays a role as well, because many of the ova are fertilized, but only one zygote is injected. So, yeah, if you guys might want to weigh out the different possibilities.
So, Shane and I tried IVF, and it didn't really seem to work for us. So, is there any similarities or differences between the two?
So IVF, or in vitro fertilization, is similar to ICSI because ova are extracted in both cases and fertilization occurs outside of the body. Also, they have the same possible risks, such as multiple births and genetic defects. However, in ICSI, sperm are injected directly into the egg, and in IVF, the concentrated and washed sperm are just mixed with the egg. And IVF requires a lot more time and creates emotional stress, especially on the parents. But ICSI has a fertilization rate per egg of 70% and fertilization rate for infertile parents as 99%. And that is if the wife has healthy eggs. So ICSI is a great possible treatment for parents who were unsuccessful with IVF. so I would really recommend ICSI. So what do you guys think? Would you want to go through with this procedure?
Okay.
Oh, sure. Why not, man? That's good.
Yeah, we'll go through.
Okay, sounds good. Oh, hello, Dolas. You're here for your checkup.
Yep.
You are very pregnant.
Here I am. Oh no! My water broke!
Let's rush you to the operating table. You gave birth to a beautiful baby girl. What are you gonna call her?
Don't even.
Wow, what a big head.
I know.